我爱中医。
我愛中醫。
J'aime la médecine traditionnelle chinoise.
Ich liebe TCM.
Szeretem a hagyományos kínai orvoslást.
من علاقه زیادی به طب سنتی چینی و طب سوزنی دارم.
பாரம்பரிய சைனா வைத்திய முறைகளை மிகவும் விரும்புகின்றேன்.
I love Chinese medicine.
Chapter 14. Welcome to everyone. Today we have a really special guest from the OCTCM College, Professor Wu Bingjiang. Acupuncture is a collective term for the practices of needling and Moxibustion therapy, which involve treating illness by inserting needles or applying heat to specific points of the human body. On November 16, 2010, UNESCO inscribed traditional Chinese medicine, including acupuncture, into the representative list of the intangible culture's heritage of humanity. Needling involves using specific techniques to insert needles into acupuncture points of the human body, resulting in different types of sensations. The aim is to achieve the therapeutic effect and treating diseases. When the needle reaches each layer, there will be a sensation known as de qi for the patient and the practitioner. This sensation is usually described as a sinking, tightness, or sticky sensation. On the other hand, talking about Moxibustion therapies, also known as Moxa therapies, involves using small cones or long rolls of moxa. It's a therapeutic herb commonly known as mugwort that are ignited and placed on near specific fixed points of the body surface, and this has the clinical application to heat the body and treat different types of diseases. The origin of these techniques can be traced back to the Neolithic age, when people experienced pain or discomfort and they instantly started to use massage. At the time they were patting and they were starting to use sharp tools to the affected areas in order to relieve the pain and the symptoms. After that, they developed what we know as the acupuncture stone that eventually evolved till the stainless steel needles that we use today. The most important records come from the Yellow Emperor Inner Canal when they talk about 9 different types of needle: the Chan, the Yuan, the Shi, the Feng, the Bei, Yuan Li, Hao, and Chang needle. All of these needles have their own specific therapeutic effect, and they are described in the Ling Shu part of the Yellow Emperor book that we just mentioned early on. Every needle has its specific function, and giving the example here, the Shi needle resembles a precious sword with edge on both sides. Its name comes from its shape and resembles a sunken weapon called Bei. It is commonly used in surgery and different types of techniques to drain blood and treat pus, and it was used in the clinical practice. The origin of moxa is quite interesting as well. It's related to the discovery of fire, when people experience discomfort and seek for heating with the fire, and eventually this developed into Moxibustion, and they started to use different types of branches and different types of tools that at the end of the day were used in the clinical practice as Moxibustion. Research has shown that acupuncture can stimulate the nervous system and improve the body immune system. Also, it has an important role as an antiviral and antibacterial. Acupuncture can help to regulate the body endocrine system, improve the nutritional status, improve the resistance, promote overall health. It can also improve the blood circulation, help to treat diseases and prevent diseases, and can assist in the treatment of various diseases, including pain, anxiety, depression, infertility, and other internal, external, gynecological, and pediatric conditions. From the historical point of view, in 1973, medical silk books were inherited from the Ma Wangdui number 3 tomb in Changsha, containing the 11 meridians of Moxibustion, classic of the lower limbs, and the Yin Yang 11 meridians Moxibustion classic. These texts discuss the distribution and manifestation of the 11 meridians as well as Moxibustion therapies, forming a complete meridian system. And in 2012, the oldest known acupuncture human body model was unearthed from a Han tomb on the Mount Lao, Guang in Chengdu province. It has 14 centimeters higher and it has 117 acupuncture points and annotation of the anatomical location of some of the organs like the heart, lungs, and kidneys. As we just mentioned, the Yellow Emperor Inner Canal, the Ling Shu, is the earliest and most complete classical work of traditional Chinese medicine among the existing medical literature. It is the first comprehensive summary of acupuncture and therefore referred as the Acupuncture Classic. It records the 12 primary meridians, 15 collaterals, 12 senior channels, 12 divergent channels, and various related points. And it also provides a detailed discussion on acupuncture points, acupuncture methods, indications, and contraindications. Following the Yellow Emperor canon, subsequent dynasties improved the acupuncture theories. For instance, in the Jin dynasty, the medical scholar Huang Fumi wrote the Zhenjiu Jia Yi Jing, or the ABCD of acupuncture, which is the second most comprehensive summary of acupuncture. The book discusses the theory of the organ, the meridians, and established 349 points, providing description of their locations, their therapeutic effects and manipulations, and also introduce acupuncture methods and treatments for common diseases. In the Tang dynasty, the medical scholar Sun Simiao make a really good improvement into the acupuncture thanks to the method and application of the Ashi points. Then, during the Song dynasty, the acupuncture expert Wang Wei compiled the Bronze Man Acupuncture and Moxibustion Atlas, who identified 354 points in a bronze statue with precise acupuncture locations. Then, in the Yuan dynasty, Huan Boren authorized the 14 meridian unleash, which is the first time that combined the 12 meridians, the Ren, the Du meridians, making the 14 meridians, subsequently to doing some research. Later on, in the Ming dynasty, it was a flourishing period for the acupuncture. It was a period of compendiums and compilations of textbooks, and here we can find the great book of Professor Yang Jichou, the Great Compendium of Acupuncture, which is the third comprehensive summary of acupuncture, where gathered and summarized all the clinical experience from different doctors through all the history of acupuncture. In the early Qing dynasty to the Republican era, or the modern era that was introduced to China, the acupuncture continued to develop, but gradually start to decline. Works like Acupuncture Feng Yuan continue to pass down. After the founding of the People's Republic of China, the Chinese Acupuncture Society was established on the mainland to inherit and develop acupuncture research. Researchers combine modern medical clinical experience and research achievements, published many acupuncture academic works and papers, and created new forms of acupunctures, such acupuncture anesthesia. Acupuncture research has evolved from merely organizing ancient tests to systematically observing its clinical effect, exploring the mechanisms of acupuncture treatment through various disciplines like modern physiology, anatomy, histology, biochemistry, immunology, and molecular biology. Acupuncture first spread to Korea in the 6th century and later reaches Japan through missionaries and to Europe, starting with France, and currently there is 103 countries that permit acupuncture. There are more than 80,000 TCM medical institutions overseas with around 300,000 TCM practitioners worldwide.